behind this, and that was really the inspiration behind the study. One of the big questions we often face is, a parent has a child with infantile spasms already. They have already gone through that hell, and they are very nervous about having other children. And they're conflicted because on the one hand, many of these children are very severely affected, and they are not necessarily what those parents were envisioning for their children, and they are desperate to maybe have a child that doesn't have infantile spasms or that doesn't have severe neurologic impairment. And they want to know, well, how risky is it? And sometimes we know exactly how risky it is. If we can identify a very specific cause, a lot of times we feel good and say, well, the future child is very unlikely to have that specific cause, and therefore the risk of infantile spasms in that child is pretty low. The problem, though, is that we have a lot of patients where we do plenty of workup. We take pictures of the brain, we have MRI, we have other diagnostics, we do substantial genetic testing, and despite all of those diagnostics, we don't know why the kid has infantile spasms. And that's a very scary situation for those parents. And their natural question is, well, how many of your other patients have gone on to have children that were affected by infantile spasms or by epilepsy? And our reaction off the cuff, just thinking about those patients but without studying it, was that, it's really not that many. We can only think of a couple. And in our case, there was just one child in our pretty large cohort that then had a sibling that also had infantile spasms. And that was exactly with that scenario where we had done lots of diagnostics, hadn't figured out why the first child had infantile spasms, and then the second child had infantile spasms, and we don't know why that kid has infantile spasms. So that's scary, but that's actually quite rare. So under 1%. So having rigorously looked at this and searched through our database and looked at family histories of these indexed children, we're actually quite a bit more confident that the risk to subsequent children is low in the absence of specific genetic etiologies where we would think that if we identify something that's autosomal recessive, we'd say, okay, there's a 1 in 4 chance for the next child to be affected. But this is pretty reassuring. Having a child with infantile spasms is an incredible stressor. It's hard to even describe or appreciate how much stress and how many opportunity costs are endured by that patient, the parent, other family members. I think a pretty typical scenario is that the family already has a couple kids. They've now had a child with infantile spasms. They are not interested in rolling the dice no matter what the probability of infantile spasms or epilepsy or autism in the next child is. And that definitely affects our results a bit. So one thing we looked to check was, were there differences in the demographics or etiology classification of patients who did or did not have a sibling? And we actually didn't see a difference there, so that made us kind of hopeful that at least among that subset of 294 patients who did have a sibling, that they were fairly representative of infantile spasms patients overall. But there are certainly cases where there was an identified genetic cause with a known relapse risk, and a lot of times those children did not have a sibling because the parents were not interested in rolling the dice or doing advanced things like pre-implantation genetics and selecting embryos that are unaffected, that sort of thing.